Hello, welcome to Life Matters. Well, when you look at the healthcare industry from a nurse's perspective and look over since the late 60s to current day, there's many things that have gone on. And in part one of our interview with Nancy Valko, who's a spokeswoman for the National Association of Pro-Life Nurses, we covered about 30 years, but we still have a lot to go. And we want to talk with her about what is really happening for nurses and the healthcare profession with all of the goings on between the legal and the political and the medical. So welcome back, Nancy Valko.
Thank you for having me, Brendan.
Nancy, I wanted to talk to you when we last spoke last week was the idea of futility. That's a word that comes up in the medical profession, and the futility policy at various hospitals. What is that, and that people should know? And would you have an example of what a futility policy is, and what's is it Damocles' sword hanging over our heads?
Well, it can be, and even though I really believe from working in the profession for so long that most doctors and nurses are very ethical, but we've been kind of forced into a funny position. In 1991, in response to the Nancy Cruzan case, where a woman said to be in a persistent vegetative state died after 12 days after having her feeding tube removed, two senators, Jack Danforth from Missouri, where I live, and Daniel Patrick Moynihan came up with this idea of a Patient SelfDetermination Act. And this was something that came up, and what it was meant to do was intended to promote awareness and discussion of healthcare issues in preparation for medical decisions at the end of life, and they felt it should be for anybody. And if somebody couldn't speak for themselves, and they held the requirement that any healthcare institution which expects to receive Medicare or Medicaid funds must inform patients upon admission of state laws governing self-determination issues. And that was kind of a funny thing, and it was not voted on. In fact, there were quite a few people against it. It never was voted on by Congress, but passed through on a Budget Reconciliation Act, and it took effect in 1991. And it really changed things because it kind of put the onus on people with holding treatment, or they didn't want to live if they be like Nancy Cruzan, or they would be unconscious or minimally conscious. And it really changed things, and of course it scared the heck out of the healthcare institutions, and we had to tell every patient about it, to the point where at one time I was asked if I wanted one when I went in for a mammogram, a simple mammogram. Kind of crazy. And it kind of went on from there, and it actually was promoted as a way to keep doctors from over-treating you. That was it. And they said, you're going to take your power back. The Right to Die groups were behind this and really wanted this. But a funny thing happened on this way to a Right to Die nirvana. A lot of people, they looked at it, and they had relatives who were unconscious or couldn't speak for themselves with Alzheimer's or dementia or confusion, even temporary, and they made decisions contrary to what the doctors were recommending. Some of those cases went to court, and the doctors were shocked when the judges often ruled in for the families. So this idea of futile care came up, and it said basically the doctors should not be required to give futile care, which actually didn't have a real medical definition. We've always had futile care defined as something that's impossible, harmful, or medically, it wouldn't help somebody. It was futile. And that was fine, and that's something that no one needs to have. But futility got a little bit wilder because you're talking about people who are unconscious or unable to speak for themselves. And that made a big difference. And all of a sudden, doctors were making these decisions, and people were fighting it. So they came up with the idea of a futility policy, and even the American Medical Association couldn't come up with a definition or a list of things that were futile. They kind of left it up to the doctors. And there was a real push for it, even in Catholic hospitals. And what this would do is allow doctors, usually with an ethics committee, to overrule patients or families when it came to continuation of treatment. And a lot of people are upset, and I saw this actually happen in 2001 when I was called to see a gentleman who was in his 60s in a terrible car accident. They didn't expect him to live, but he did, and he was on a ventilator. And the doctors gave him like no chance of ever having a reasonable life or waking up or even getting off the ventilator. They said he's just too far gone. And this was at a level 1 trauma center, one of the best we have in St. Louis. And the family called me in and they go, "What do you think?" And I had been working with people. I told a story yesterday about a young man I worked with. And I started doing things with people who were perceived as unconscious or vegetative, that new term. And many of these people woke up, and almost all of them got better to some degree. So I looked at this guy, and I gave them a pamphlet that a friend of mine had developed, which had a lot of what I did in it, encouraging people to wake up and to do things, and a very gentle approach. And so the family started doing it. But after 2 weeks, they thought they were seeing stuff, but the doctors told them it was nothing but reflexes. So after about 2 weeks, they said, "Listen, he needs to be off this ventilator, and if you don't agree, we're going to take it off or you find some other place to go." So after a wild time, we found a place that would take this gentleman, and we transferred him over there. And as soon as he got there, he wound up getting a fever. And I was asked by the staff, they said, "What's wrong with this family? Are they, what's their problem? They're kind of crazy, aren't they?" And I said, "No." And I said, "Look at his temperature. What are you going to do about that?" So I called the family. We got him into intensive care. He almost died, but he made it. And the upshot was 2.5 months after his accident, he was awake, alert, and starting to eat by mouth. He made an almost complete recovery.
Wow, that's fantastic. That's a terrific story. But this committee, futility committee, I would imagine with Obamacare and rationing on the horizon, that this is going to become a bigger and bigger issue in the healthcare industry, the hospitals and healthcare institutions.
It really is. There's going to be a problem, if not already. I already read a Medscape article about how many doctors have started being careful of what they ordered and stuff like that, a form of rationing. And most people don't want to do that. But you have to understand that the old Hippocratic Oath, which was wonderful, it was a sacred covenant with the patient, they said, well, that's not good. And also it mentions no euthanasia and no abortion, so we've got to change it. So they came up with many different things, and most of them were about the doctor's commitment to the community to do the best he could. And that changed everything entirely, because it was no longer commitment to the actual patient, but the greatest good for the greatest number. And you even saw some Catholic ethicists talking about scarce healthcare resources. And I saw things where they said, guess how many kids we could vaccinate, poor children, for the cost of tube feeding somebody for a couple of years. And it was that kind of equation, and it really did change things. In the meantime, people were being scared about things like Alzheimer's, a fate worse than death. My mother happened to have Alzheimer's, and I've written on taking care of her. Personally, I really love people with Alzheimer's and dementia. And everybody thinks it's futile, and it's not. Tomorrow I'll be visiting a friend of mine who's a doctor who made me her power of attorney, and she said, keep him from doing anything bad to me if I get dementia. Well, she did. And right now, the place where she's at is pressuring me to make her a do not resuscitate. And I said, no. She said she did not want that unless she was actively dying, and she's not. And for a while, the head of the place wouldn't even talk to me. And they talked to other friends who tried to convince me that CPR is just terrible. You don't want that for her, and she's 86 years old. And they said, you don't know. And I said, I've been a nurse for 47 years. I've done my share of CPR. I do know about these things. But it really, between that and the media, and even in your regular TV programs, there's that message that you shouldn't be a burden to yourself or others. And that had really opened the door to assisted suicide, which happened in 1994 in Oregon. It became the first place to pass legalized physician-assisted suicide. And it was shocking to many people, and the head of the Oregon Medical Association later admitted they were talked into taking a position of neutrality on it. And I saw this happening with hospice and other places too. They would be told by groups like Compassion and Choices, the Right to Die groups.
Now, that was the former Hemlock Society. They've
The
gone
former
through
Hemlock
many
Society.
name changes, and they've come up with now something they think is appealing to the public, Compassion and Choices.
Well, as more people were saying, yeah, I'd want to die rather than be a vegetable or have Alzheimer's or whatever, doctors and nurses are no less influenced by the general culture. And they would argue that since there was maybe a minority, but a significant minority, that these medical associations should take the position of neutrality, neither for nor against. The AMA has continued and just recently had to do it again, saying that assisted suicide is against medical ethics. And they've held strong, but they were under tremendous pressure just recently to at least take a position of neutrality. Now, the big hospice and palliative care organization has taken a position of neutrality. And in Oregon, the head of the Oregon Medical Association was talked into it, and it passed. And he regretted that. And so when it came up again, it had to be voted on again on a technicality, the Oregon Medical Association said, no, we're against it, but it was too late. Because if doctors don't care and nurses don't care and people want this, it's all about supposed autonomy. But it's an autonomy that futility policies can overrule you. It gives the power back to the doctors. That's what's so interesting about futility policies, is it's taking it out of your hands when you were supposed to be getting all this stuff. They talked about the paternalistic doctors, and now all of a sudden it's like families, and I saw that. I went to a pediatric ethics conference one time where the lawyer who was arguing, he says, really families that refuse to remove feeding tubes from their vegetative or comatose children are really being abusive. That happened with my own grandson, who got a very rare disease and was very, very sick, and one young resident came in and told the family, how long are you going to keep torturing your son?
Oh, my goodness gracious.
And that's really what we've kind of gotten to. It's almost like it's enforcing this type of stuff, and it has made a huge difference in the way people think. People think they get power and control if they go for the right to die, but in a way they become victims of it at the end, and people who were not supposed to be victims have become victims, like my friend who was in the car accident.
Well, it sounds what is occurring here in the healthcare industry is that it's no longer, wanting to be in the industry to treat the infirm and to heal. It's almost as if, we're here for a while, and if we can withstand it financially, in other words, either the hospital saying that, or the patient, or the insurance company, then we'll let them stay. But it doesn't bode well right now, and now we also have on the horizon, and actually occurring right now, we have the conscience rights of healthcare workers. The Weldon Amendment has just been trounced on by the state of California. Can you speak to that a little bit?
Well, that's really interesting, because it's not just taking choice away from the families and people with disabilities or other problems. It's taking away choice from those of us who are doctors and nurses who are ethical. It's been said by the Compassion and Choices people, the now assisted suicide, they no longer call themselves Right to Die, it's assisted suicide. And they talk about people like me should not be allowed to exercise our idiosyncrasies at the expense of patient care. And they said it's all about patients' autonomy, and if we don't want it, we should find another profession. We are the thin white line that are a real protection between people who think certain people should die and the general population. But we are getting into a whole lot of trouble. And recently in Illinois, for example, the governor there just signed a law that does not that says that pregnancy care centers that help women must let their people know, must inform them about their option of abortion Interestingly, it doesn't go the opposite way. The abortion clinics don't have to talk about the pregnancy care center options. There's a real effort being done to make those of us who are ethical either refer or get out of the profession and being called unprofessional and not offering full medical services. And that's really scary. I've had student nurses contact me ready to make another deposit on their education, and they go, will I be able to have a job, or will I be hounded out? Mm-hmm. And the American Nurses Association doesn't back us up at all. They don't get involved in those things with conscience rights. And interestingly, when Oregon passed their legal assisted suicide law, the Oregon Nurses Association came out with guidelines for nurses to do, and one of them included no judgmental word or action towards a colleague who is assisting or taking care of someone who is going to be committing suicide, or the person themselves, which I said, that's kind of crazy. Does that mean if someone's on a ledge and we're trying to talk them down, if they say they're terminally ill, we have to shut up? It's two different levels of care for people who are suicidal. Certain people who say it's their right, we're supposed to go along with that. However, we try to save everyone else who is suicidal. One of the first things we do when someone is suicidal or depressed or whatever is we call in for help, particularly when they're suicidal. And I've worked with many, many suicidal people over the decades. And what happens is we have an assessment psychologically or usually psychiatrically to see if they're a danger. We get them help. We do everything humanly possible. The one thing we don't do is say, well, go ahead. But the right to die assisted suicide people now say that is their right. And we're saying, and this is what I say too, I will do anything for my patients except kill them or help them kill themselves. And I said, it's stupid to make us do it. That lends a nice palatable patina on what's really a very, very dirty business. And in Europe already, they're doing people who are just tired of life. One woman was immediately euthanized when she asked because she had lost her daughter. And within a few minutes, she got it. We are abandoning people. We are having two sets of standards. Suicide is a terrible thing. And personally, as you know, Brendan, I lost a daughter to suicide when she was 30 years old after a 16-year battle with substance abuse and other issues. And what was particularly bad, we tried very hard to save her. When she did commit suicide, a detective said, what did the medical examiner mean when he said her death was textbook final exit? That's the title of a book by Derek Humphreys, who was one of the first euthanasia supporters. She had read that book and had told me, and she said, if I do it, I know how to do it, and I won't tell you. And we tried desperately. All of her friends, her husband, everybody did. And in the end, she became a victim of assisted suicide. And her reasons for it was she felt like she was a burden, that she was not helping her young daughter, all sorts of things. You know, she said, my life's not going to get any better. We got her help. She had been admitted. And in the end, we lost it. But Oprah Winfrey had a story about a woman who helped reluctantly her mother, who had Parkinson's, not even terminally ill, to end her life, and found a doctor in New York that would help. And reluctantly, her mother insisted that she be there when she did it. And this girl afterwards, she said, it was, really tough, but I'm so glad because I honored my mother's wishes. This is politically correct to an insane attempt. And I wrote to Oprah, and I wrote, I wouldn't have been sitting holding my daughter's hand while she committed suicide. I would have been fighting with every ounce to the very last minute to save her life.
And yet the assisted suicide is trying to cut off your trying to help the person, basically, saying, shut up and go home or something. Nothing to see here, move along.
They really are, and we're pushing. My association, National Association of Pro-Life Nurses, we're very big on conscience rights. And the conscience rights that we have now federally are mostly with abortion. We need them for these other things. And in fact, back after Nancy Cruzan died, I was hearing from nurses who were being told they were not going to be given a choice if this happened to one of their patients. So we came up with the idea of a bill based on workplace discrimination that we did not have to participate. And it took 4 years, and we did get it passed. It was watered down during those 4 years. I wanted it to cover lethal injections, lethal overdoses, and I was told, oh, that can't possibly happen, especially here in Missouri. And I said, Kevorkian mean anything to you? And I wanted damages, and it got watered down, but we do have something that any healthcare provider or employee can refuse to participate in deliberate withdrawal of treatment death decisions based on, and they always put that in their religious objections or ethical objections. I did not want it to be about religion. That's what they're trying to say, is anyone who's against it, they're just religious crazy people. And they should get out of the way and let people do what they want. But those of us who work in the healthcare field are being pushed out. And it's become very hard to talk about these things. Before I left the bedside, I would meet many doctors and nurses, and most of them said, well, I guess it's okay. And I said, do you want to do it? Oh, I wouldn't have to do it. I said, are you sure? Referring? What happens if you've got a hospice patient and they want to do it? And that had happened in Oregon, and many hospice nurses left hospice nursing because of it. They said, I wouldn't be made to do it. I said, yes, or you'd have to find somebody that would do it. And that made them think a little bit. But what was interesting, I noticed that the doctors and nurses who supported this right to assisted suicide, medically assisted suicide, they were not the first people to answer your call light or to go the extra mile. It was the people who wouldn't do it who were the best doctors and nurses.
Mm-hmm.
I tell people, with your doctor, go ahead and ask them where they stand. It would be good. It worked with the doctor, the cardiologist who took care of my daughter, who said, well, I'll do whatever you want me to do. Let her live, or not. And because I stood up and I said no very strongly and that this was discriminatory, he totally changed, has become very supportive. And I think sometimes people need to hear that. Doctors and nurses are like everybody else. We need the support. But it had gotten so bad in the hospital I was working with, somebody who knew my work in pro-life was visiting a patient, came up and they said, hi, I know who you are, but I won't say anything. I don't want to get you in trouble. I did talk one woman who really wanted to die, and she said, I'm going to go see Kevorkian afterwards if something doesn't happen. She had terminal cancer. And some other nurses called me in. They said, can you talk to her? We don't know what to say. And I said, we'll let the doctor know. And I went in and talked to her. And after we talked for a while, she had a different outlook. And she said, let me think about it. And she decided against suicide, which was really interesting. And she was so happy. She was like someone who just survived a plane crash. But a few days later, her friends came up to me. They found me, and they said, we are going to report you. We want you fired. You interfered with our friends' rights. You can't do that. We're going to try to get rid of you. This is how bad it is.
Wow, that's really something. And were you fired from that particular hospital?
No, but I've been threatened with firing on that case I told you about yesterday. I was threatened with firing. But also I was on ethics committees, and I did not get a good reception. I asked questions, and I said, well, if we do this, what about that? And it would make them so mad that somebody at one ethics committee meeting, the head of a big department, said, Nancy, there are days I could just kill you.
All puns intended?
I didn't. Oh, she was furious. And I wanted to say, and that's why I don't sign an organ donor card. But I refrained from that. I was a single parent with 3 children.
Right. Well, Nancy, unfortunately, our time has come to an end. I can't believe it, but it's been such a pleasure chatting with you and talking to someone who really has lived the last 47 years or whatever it is in the nursing profession, and has seen what's gone on in the healthcare profession. And it doesn't look bright right now, but hopefully sometime in the future things will turn around.
if enough of us stand up, and as I tell people, no is a very powerful and often life-saving word.
Well, very good. Well, folks, we hope you enjoyed today's show and found it to be unique, informative, content-rich, truthful, and thought-provoking. Thanks for watching. I'm Brendan O'Connell, your friend for life. Hello, welcome to Life Matters. I'm your host, Brendan O'Connell. Why is the website Maria Talks so objectionable to so many people here in Massachusetts? And why should taxpayers be footing the bill? Are parents' rights overtly or covertly being trampled? The old communist Soviet Union had a newspaper called Pravda, which means the truth. Is the pro-abortion lobby trying to sexualize teenagers and calling it comprehensive sex education? And why is the website trying to inform teenagers how to get an abortion without even informing their parents? We'll ask today's guest, Linda Thayer. Well, welcome, Linda.
Thank you for having me. It's good to be here.
Linda, could you briefly give your background, why we have you on today and that sort of thing?
Well, right now I'm on the board of directors for Mass Citizens for Life. Most of the work that I do, though, is education. I speak to probably 5, 6, 7,000.
Well, we're very fortunate today to have Alex Schattenberg in-house. He is the international guru as far as euthanasia and fighting euthanasia across the world. He heads up, he's the international chairman of the Euthanasia Prevention Coalition.
Yes, yes.
Well, Alex, tell us, what is happening in the world today? Can you tell us some of the continents you've been on and that sort of thing? And
Yeah, I think the first point is that in Massachusetts, the whole ballot question 2 is important, but that is assisted suicide. And in our organization, it looks at both issues of euthanasia and assisted suicide. So it's a wider thing. And euthanasia is when somebody would directly cause your death usually by lethal injection. Of course, they could do it in many ways, but usually it's by a lethal injection. So they